I would say if I had a thoracic pain or upper back pain and there's a choice between seeing me or you, I would see you because your technique is so good, so
Oh, thank
exacting,
you.
and you have that, with the ultrasound, you just have patience. I'm a physician and I want to do everything fast, but the thoracic area, you do have to be very meticulous with it because the lungs are there. So your technique is just excellent.
Oh, thank you.
And you know this because of computers and cell phones. Like right here, man, we're just the strain is enormous that we're all under. Our thoracic spines are under. So you're probably seeing more and more, upper back pains and.
Absolutely. And I even noticed that in myself. Like if I mean, not even just like being hunched over patients, but when I'm at home, I'm like, man, I'm like, you're cooking, you're like doing dishes, you're taking care of like, like kids, like you're just constantly hunched over.
Yeah.
Always.
Even spinal cord irritation that causes burning. Like we get patients, right? They have this terrible body burning pain and they don't realize it's from the tension, which will show out an MRI or that where this nerves in the spinal cord get under tension.
So thoracic instability, so ligament laxity in the thoracic spine that's causing the bones, to move more than they should, is contributory towards things like degenerative disc disease, people that have, disc wear and tear that they'll see on MRI or X-ray, even disc herniation, bone marrow edema, swelling at the bone from trauma, slipping rib syndrome, subluxation. I see a lot of that. People that have ribs that just do not stay in place. They're constantly at the chiropractor or self-adjusting themselves. Myofascial pain syndrome. So all those tight trigger point, tight muscles in our traps and along our upper thoracic spine actually all can be related to ligament laxity.
Intercostal neuralgia or intercostal nerve. So the nerves that innervate the skin, they are located right underneath the ribs. So obviously if a rib's moving too much, how would a person kind of know if they have thoracic instability? Are there signs or symptoms? And then how is the chest involved sometimes?
Sure. So the thoracic instability is actually one that is mostly diagnosed based on like signs, symptoms, and physical exam. Like if you get MRIs or standard X-rays, unless the rib is completely out of place or something on X-ray, you oftentimes don't catch it on imaging. So people that get a lot of clicking, popping, snapping, or they, like I said, feeling like they have to self-adjust, they get a lot of muscle spasms, a lot of muscle tightness in that area. A lot of times patients will have seen like chiropractors and they, get adjusted however long, but it just comes right back. Like they cannot hold things in place. They've done, physical therapy. They've done all the things to try to strengthen and relieve the muscle tightness, but it just keeps coming back. These are all things that we put together when making that diagnosis. The chest, your ribs that start at your back, they're going to come and, all the way around your body and attach at your chest. So I'll oftentimes use the analogy of a seesaw. If you have instability back here and, maybe it's, going to kind of seesaw back and forth with your chest or just kind of put more pressure there and even contribute to an instability that can develop there.
Yeah, and then you end up getting chest pain. Like I've had patients, you have too, that they feel like they're having a heart attack or even sometimes shortness of breath.
But like they've been cleared, like their heart is fine. Obviously they've done the appropriate workup for that and they're just kind of left, stumped.
There's different studies that have shown that when you have the normal spinal curves, you can handle anywhere from 5 to 30 times more force. Like we just went through Hurricane Ian. So if you went into our backyard, we had this like unbelievable backyard that Mary and I have been planting things in our landscaper for the last 20 years. And if you went there today, the only thing that survived was the palm trees. Like almost every single thing that we had ever planted. But the palm trees, because they're movable.
Oh, yeah.
So that's the same kind of analogy with the spinal curves. If you have just a straight curve, it can't handle all the forces. But if you have the normal spinal curves.
And so here, if we kind of take our normal spinal curve, but again, you have, bad posture, you're like slumped at a computer, you're bent over all day, probably sitting like I am now, then what's going to happen is your head posture gets more forward, your neck gets straight, in order to compensate, honestly, for the change here, like you actually might get more of a hunched back in your thoracic spine. We call that exaggerated kyphosis. And then even like almost like what people would say like a sway back, like you get exaggerated lordosis in your low back. And all of this is just excess force literally on all your joints as it kind of trickles down.
Yeah, and then when we measure it, because with the various x-ray techniques we do in the office, some people's heads are 3 inches, 5 inches,
Yeah.
They're just so far.
Forward.
And we sometimes forget probably the number one cause of pain, like in the lower back, in the neck, in the thoracic area, is probably just plain old slouching.
Yeah, probably.
So what's supposed to happen is you or I are either supposed to be on the front of our chairs here, and we're supposed to be like this, so and then with our computers, if our computers were up, this is actually increasing our muscle strength. But what we normally do is we put our back here, and then we're not all the way back, so we're only partially back. So once we're only partially back, then of course
You got room to slouch.
you slouch, and then what happens is you lose the cervical lordosis, you lose the lumbar lordosis, get back pain. Then you said you get the hunching of the thoracic spine, and then of course right around here at the cervical thoracic junction, you end up with pain. And then you can even end up with pelvic problems, lower extremity problems, and all kinds of problems if you don't do anything about it. So you talked about some of the symptoms of spinal instability already, but why don't we just go through them again?
Sure. Some people with spinal instability actually feel unstable. They feel like, hey, if I move a little bit, like if I bend over to put my shoes on, or even, this is actually really common, if I'm brushing my teeth and I bend over to spit, like I feel like my back is going to give out. Okay. I don't know why it's always brushing the teeth, but I hear that all the time. Or they'll say like, gosh, I need to like click or pop, or I can't be, comfortable until I self-adjust myself. I get a lot of tightness. There's a lot of big muscles that literally travel from your neck to your low back. If you had a lot of motion with your head or at that neck thoracic junction, all of these, the length of that muscle could spasm and tighten, trying to help hold you together. It's not going to be comfortable.
Yeah, exactly. So you're basically saying you could have an instability here and it actually cause low back problems, because likewise, if you had instability here, that could cause this muscle to tighten, and then could cause problems there. And then instability is a progressive disorder, so you could start out with you just tweak something here, then it's going to spread to the next level, the next level, the next level, and then the body's mechanism to stabilize the loose segment is to tighten the muscles. That's where you can get 1,000,000 massages, but it's never going to resolve it because it's an underlying joint instability that's causing the muscle to be tight. So that's a symptom that if you have that, a muscle is always tight, you got to think of, well, you probably got underlying thoracic instability and it needs to be treated. So how do you treat thoracic instability?
Thoracic instability, as caused by ligament injury or ligament laxity, you simply just need to tighten those ligaments. Like that's what's going to actually resolve the instability and allow those symptoms to go away.
This just kind of shows like some of the spots where you might actually do prolotherapy too. So typically, where is prolotherapy done for the thoracic spine?
In most cases, people need what we call their facet joints treated, and actually where the rib attaches to the bone. So in most cases, we'll do almost what we like 2 lines of injection. So one at the facet joints and then one where the rib and the vertebrae attach. And then the spinous processes actually are also a common place to inject as well.
Okay. And then sometimes you brace, right?
Yeah. I get a lot of questions about bracing, actually, because people will always say, well, if I brace, don't I lose muscle mass? Isn't that the opposite of what I should do? I'll say, well, you raise a good point. I don't want you just to brace for the sake of bracing, because then your muscles don't work. But when we're actively trying to heal ligaments and tighten ligaments, especially in the thoracic spine that's already under so much stress because we have to breathe all day, right? Yeah. You can't just tell someone, hey, stop breathing so we can tighten up the ligaments in your back. It's not good advice. So we'll brace them to try to help hold everything together while it's healing and combat some of just the extra motion that you have in that area.
Technically, somebody just watching this, they could get some type of a brace and just see if the bracing helps them, right?
You could. It's a little kind of inexpensive, conservative way to try to see if that is what is happening. The other thing too with the thoracic spine that I'll tell patients is it's a lot of joints. It's a lot of joints of the vertebrae connecting to each other, and then the vertebrae connecting to a rib on each side. So just imagine, we're trying to stabilize or tighten all of those at once. That's where the brace really does help us to kind of help hold the glue to set, so to speak.
If a person at home uses a brace but it doesn't help them reduce their pain, does that mean they're not a prolotherapy candidate?
No. If you wear a brace and it does help your pain, that's a pretty good indicator you're going to be a good prolotherapy candidate. But if the brace does not help your pain go away, that still doesn't rule you out as a prolotherapy candidate, because there are other variables to consider. If you're wearing this brace and it's stabilizing your thoracic spine, but you really have a neck issue or you really have a low back issue that's contributing, that could be why the brace isn't helping you. Or if your anatomy is in a way where like a nerve is getting pulled on, or there's a lot of nerve tension or a lot of rotation of the bones, just bracing on its own may not help you feel better, but you still actually would be a good prolotherapy candidate, likely.
Those are great candidates. I love these kind of figures, because look at this, like just with one vertebrae in the thoracic spine, it has, 13 different muscle attachments, 13 muscles on one vertebrae. So it means that if you have instability here and the bone's moving too much, it can affect 13 different muscles.
That's
I mean, it's
crazy.
amazing. We've often said what prolotherapy is really, really good at is eliminating pain. And I think one of the ways it does it is we inject these spots and the muscle tension goes away and then the pain goes away. And some people have traumas. This is one of our patients who had, obviously somebody could have a fracture, right? We see a lot of post-fracture pain because they have the fracture, but when they had the trauma, it injured the ligaments. And the ligaments, including the thoracic spine, they just don't show up on MRI.
No.
So you could have a pretty bad ligament injury, but it's not going to show up on MRI. So this person's going to have a lot of tension because there's not even cerebral spinal fluid, which is the white area. So again, if you have burning pain and nobody's giving you a good reason why you have that burning pain, then it's probably you have spinal cord tension from some type of instability somewhere in your spine. You could see where the spinal cord is supposed to be in the middle here, but look at it, it's right along where the vertebrae are, the discs are. So I think what we would like to do is make sure that we show you, doing a thoracic procedure and how you do it. Now, how would you determine how many visits a person needs?
So that would depend always on how bad their symptoms are when we first see them, of course, what their goals are. So I use this analogy all the time. I've probably said it in a video. Someone is 90 years old, they just want to walk around their house. They may not need as many treatments as, a high-level athlete that needs to perform at a, very, very high athletic level. On average, the thoracic spine does tend to need 1 or 2 treatments, maybe more than like a low back would, just because, again, it's under all the stress of us breathing all day. Now, the brace does help with that, but most of the time, I would say thoracic treatments are usually in the 5 to 6 range in my patient
When
population.
you and I would also say, how much stress are they putting on their thoracic spine with looking down at cell phones?
Oh, absolutely.
And their computer setup. So ideally, the person would be looking up instead of looking down. So get your computer set up high. And when does physical therapy play a role?
Physical therapy can play a huge role once people have enough stability to be able to do the exercises appropriately without hurting themselves. I think a lot of times people that we see, they've tried physical therapy and it hasn't worked. Not that they weren't going to a great physical therapist or doing all the right things, but if you just don't have the stability in your joints that you need to do these exercises properly and do them without pain, you need that first before you can work on building muscles.
It's hard to get muscle strengthening with exercise if you have a loose joint or an unstable
especially in the
joint.
spine.
So, yeah.
If someone has thoracic pain or even slipping rib syndrome, they've been diagnosed with that, they cannot get a grasp on. They've tried all the other conservative care, chiropractic, physical therapy, massage, all these other treatments, and it's just not helping them. Absolutely reach out to us and give us a call, because these are cases that we actually can make a really big difference.